Shabbat Shalom. Welcome to Brit Am Messianic Synagogue and our Foundations of Messianic Judaism class. Now, normally, this 45 minutes each week is dedicated to questions and answers, a time where people can ask questions about Judaism, about Messianic Judaism, about what we believe, why we believe it. We have so many people that come to our community, to our congregation from either traditional Judaism, trying to figure out how to incorporate Yeshua into their faith, or from traditional Christianity, trying to figure out how and what from Judaism to incorporate into their faith. We have those coming from no faith background at all, or various other faiths, and we want to make sure we have a mechanism in place to ask and answer the questions that people have. So that's what we normally do on Saturday morning at 9 o'clock. This morning, however, we have a special guest. Dr. William Lile is with us from prolife.org. And yeah, you guys can clap. Okay, I'm going to do that again because I shouldn't have to prompt you to do that. And the poor guy's sitting right up front and would like to feel like he's welcome. So this morning we have a special guest, Dr. William Lile from prolife.org. Okay, there we go. Okay, so, and I invited him. We've been talking over the last few weeks. We're good friends, and he also does our Brit Milahs for us and is part of our community, although he's not here all the time because a lot of the time he's traveling around the country. When he's not delivering babies and doing things like that, he's sharing the message of pro-life around not only the country but the world, really. And so we've been talking, and with the amendment that's coming up to be voted on in Florida, we wanted to make sure that everybody in our community understood what was in that, what wasn't in that. And for those watching online, this gives an opportunity to hear more details, because the truth is the amendment as written has almost no details. And that's a real problem in how things are done. So in a few moments, we're going to welcome him up. Before we do, we want to give time for prayer. So please be praying for the Paulson family. Valerie's father is in hospice, and we're praying for, he is a believer, but we're praying for a transition as he goes from this life to the next that is pain-free and easy for both him and his family. It's a difficult time for the family to watch, to deal with what's going on. It is the process of life, and we absolutely know and believe that our goal in this life is to get to the next life. It's not to stay here. I posted this morning because this is the anniversary week of the loss of Rabbi Sekulow, who is one of my closest friends. There are times in our life where we have events that are both the most joyous events that we can have and the most sad events that we can have all at the same time. So please pray for the Paulson family. Pray for Bethany. A puppy dog that she's watching is not doing well. So we want the puppy dog to be healed. We believe God can heal animals too. So please pray for her. Pray for Fred, just that God continues to bless and strengthen him. Anyone else? Pray for Israel. Pray for Russia-Ukraine situation. Dave? Okay, for those watching online, we've been praying for the last several weeks for Marty and Dave's house to sell, and they're moving to North Dakota so that Catherine can go to school up there and become the best doctor ever in the creation of mankind. And so we've been praying for that. Their house is under contract, so God has answered that prayer, and we're thankful for that. And we want to pray for them to find a good home in North Dakota, as well as a good community to be a part of there that honors God and His Word. So, Pammy? Our little puppy has an infection. Also, Rebitson is having surgery on Tuesday on her eye. So please pray for her surgery to go well and for everything to go beyond the expectations of the doctors. We're thankful that CW is back. Yes, Donna? Lori's traveling home tomorrow. Pray for her travels. And then she's leaving Wednesday to go to Tucson. Yvonne? Continue to pray for Connie. She's out of the hospital. And Bo? Susie, I can't hear him, but I want to honor his request. His grandma doesn't feel good. We're praying for Susie, and we want her to feel well. Thank you for asking prayer for her. Yes. Continued prayers for healing, for strength, for God's blessings. Absolutely. Anyone else? Yes. Fabio's family is back from Brazil, and we're thankful that God kept them safe and brought them home safe. Yes. First name? Pray for Lisa. Absolutely. Anyone else? Pray for Amanda and pray for your mom. Yes. Wow. Craig's wife. Kristen. Sometimes a hard drive, it buffers with names, so mostly with names. So pray for Marilyn, who's having a doctor visit and get poked in the eye again this week, and that God would heal her back and her eye. So anyone else real quick? Yes. Yeah, for all those coming to faith in Yeshua, that God would blossom their faith and bring good fruit from that. And we're also praying, a whole group of military folks and people associated with the military are heading overseas, and we want to pray for them, especially with what's going on in Israel and so on. So please be in prayer for that. Anyone else real quick? Okay. Avinu Malkeinu, our Father, our King, we thank you for this morning. We thank you for this Shabbat, this time of rest and refreshing, this time where our mishpoch, our family, gathers together. And Father, honor our tefillot, our prayers this morning to you. We ask that you'll meet each need that's been presented and that you would show yourself above and beyond the expectations of the one who asked for prayer. Father, we ask that you will heal, you'll provide, you'll restore, you'll strengthen, and you will prosper. And we ask all of this in Yeshua's name. And we're thankful for the things you've already done and rejoice with those who rejoice in your prayer, our prayers being answered by your Ruach. And we thank you for all of this in Yeshua's name. Amen and amen. And without any further ado, I want to invite Dr. Lile up, and he's going to just share with us. I'm sure he will have some time for questions and answers within this, and there's lots of information he has up behind me that he will be sharing, and I'm going to hand a clipboard out for you to sign up for his email list to get information about things. We're going to pass it around during this class. We'll pass it around again during the regular service, but please only sign once.
Thank you, Mike. Shabbat Shalom, my friends. Rabbi, I thank you very much for this time. This is an important issue that we're going to be discussing, but we're also going to be training today. And we're going to bring you up to speed so that you can be ambassadors to defend the preborn in the womb who represent the image of God in the womb. My name is Bill Lile. I practice obstetrics and gynecology. I've been here in Pensacola for over 29 years, delivered over 5,000 babies, and still in practice right here in town. But we have a ministry called ProLifeDoc.org, where my wife and I are on the road about 40 times a year, out of state, speaking in the United States, Israel, Canada, wherever we can get an audience to declare why we are defending the preborn in the womb. So when it comes to the birth of a ministry, we went through with Rabbi this morning that Brit Am has probably met in 7 or 8 different locations since its founding. Well, this is where my ministry, which is ProLifeDoc.org, was founded. The ministry, if you recognize this building, it's right over on Bayou Boulevard. It was owned by a physician named Bo Bagenholm, and at the time, it was the largest abortion clinic on the whole Florida Panhandle. We negotiated with him. We had him sign a restrictive covenant, a non-compete. We purchased the practice, and day one, we stopped all the abortions, stopped all abortion referrals, and as of now, from the border with Mobile, Alabama, all the way to Tallahassee, there is not a single abortion clinic here on the Florida Panhandle. And that was the short-term goal, was to just stop the abortions. But it was on a Sunday after I had been attending church, and I went to the office, and for the first time I had a key where I could go wherever I wanted in the office. I had seen the first floor, ultrasound, all the exam rooms, waiting room. I'd never been upstairs. Upstairs is where all the abortions were actually performed. And I'll never forget going up that set of stairs, making a left turn, and seeing the surgical suite all ready for the next morning's abortions. You saw the suction machine, the table, the stirrups, all the instruments, and I thought, how has this been going on for decades here in Pensacola? Thousands of moms with a baby on the inside have gone up that set of stairs, have spent 20 minutes up there, and they went down the other set of stairs without that baby on the inside. So we did a presentation at my church, and that led to another church, and now it's been hundreds and hundreds of different events, throughout the country, and we're honored to be here today. This is going to be our topic today, and we're going to take this word for word. On the November ballot is going to be Amendment number 4. And Amendment number 4, if it gets 60% of the vote, and as of right now, last week, it was polling at 69% of the vote. But if it gets 60% of the vote, it says that no law shall prohibit, penalize, delay, or restrict abortion before viability, which is typically around 24 weeks, or, and this is a huge two-letter word, or when necessary to protect the patient's health, and we'll go over that word, as determined by the patient's health care provider. What's the bottom line? If this gets 60% of the vote in November, abortion will be constitutionally protected in Florida at any gestational age for any reason. Right down the street at Sacred Heart, we have babies that are surviving at 23 weeks. So this is a lot worse than where we were in 1999 when I took over the practice. This is evil. Britain Messianic Synagogue has a new ministry this morning. I don't even know if Rabbi knew that, but y'all started a school of medicine today. So we're going to take y'all. Rabbi reviewed all your grades. He reviewed your applications. We have somebody going to medical school real soon in North Dakota, but we're going to give you a little premise here. And these are some. All right, so we're at the School of Medicine today. All right, the first thing we're going to learn, and you're going to learn this when you go to North Dakota, is a little bit of Latin. And the Latin phrase that we're going to be working on is primum non nocere. Repeat it, come on with me. Primum non nocere. Now, what did you just say? In Latin, you just said first. Do no harm. They're going to give you scalpels, they're going to give you needles, they're going to give you radiation, they're going to give you chemotherapy, they're going to give you robots to play with. With all these tools, the first thing is do no harm to your patients. In Hebrew, lashit al tazik. Is that pretty close, Rabbi? All right. Do no harm. Second rule you're going to learn is that patients have rights. Before we do any surgery, we go over risks, benefits, indications, and alternatives. Doctors do not make all the decisions. Our job is to present you with the information and you decide what is best for you. But one of the first things we all learn in medical school is that patients have rights. In New York, legislatively, they say there are 22 rights that all patients have. And these are some of them, that you as a patient have the right, you will not be discriminated based on race, color, religion, sex, age. We're going to give you a clean environment, and you're going to even have a non-smoking environment. And that's the Patient's Bill of Rights just in California. 23 rights in California for all patients. So being a patient, anybody here not ever been a patient? Yeah, everybody has been a patient at one time in your life. And it's nice to know that we have rights and protections as patients. But remember, even when you look through the Constitution and Declaration and the Bill of Rights, our rights come from God. It is the duty of good government to defend and protect those rights which came from God. Even this phrase, when it comes to informed consent, when we're seeking informed consent, say before a surgery, for a patient is a person, and particular respects a patient's moral right to bodily integrity. So if we can say that this is a patient and somebody meets the criteria of being a patient, then they are a person. And if they are a person, then they have rights. I was at the University of Florida, and I speak at a lot of colleges and universities, but we were talking about patients' rights. And I asked the students, I said, if I have a patient in the emergency room that needs a blood transfusion, and if they don't get a blood transfusion, they are going to die, but they don't have health insurance. Do I still have to give them a blood transfusion even if they don't have insurance? And all the students are like, yes. I said, I agree. I said, what if I have a patient in the emergency room that, again, needs a blood transfusion, but they weren't born in the United States? Do I still need to give them a blood transfusion even though they weren't born in the United States? One of the students raised his hand. He goes, Dr. Lile, we've been taught here at the University of Florida College of Medicine that a patient is a person, is entitled to respect and bodily integrity, and it doesn't matter at all if that patient wasn't born in the United States. You need to give a blood transfusion. You have a duty to help them. I said, I agree with you. They taught me the same thing when I was here at the University of Florida. And just so you know, this is a real patient in the emergency room. And the patient that needed a blood transfusion received the blood transfusion, even though they weren't born in the United States yet. And that's the key. We are now treating the babies in the womb as patients. Right up the street, we are doing life-saving blood transfusions for babies in the womb, even though they haven't been born in the United States yet. And we have done that right up the street as early as 18 weeks gestation. So if we can do a blood transfusion, where if you had a blood drive here and you have O-negative blood, we could have used your blood to save the life of a baby in the womb. So we're going to take you to medical school. Who likes pubs? That's not the place where you go to, McGuire's or something like that. But a pubs is a peri-umbilical blood sampling and transfusion. This is where we actually will give the babies a blood transfusion from somebody who donated that blood. But that also fulfills the greatest commandment. Remember when the Pharisees asked Yeshua, what's the greatest commandment? He said, love the Lord your God with all your heart, mind, and soul, and your neighbor as yourself. If your neighbor next door needed a life-saving blood transfusion, you had a match on your blood type, would you give your neighbor a life-saving blood transfusion? Yeah. Well, you can do this for the babies in the womb as well, and we do that routinely around the country. How do we do it? We don't place it in the baby's arm. We actually will place the blood right into the umbilical vein, right there. That's a larger target. So we have a little animation of this, of how we actually do this. Right up the street, and almost every high-risk hospital will be able to provide this kind of a procedure and therapy. You have a baby that we've diagnosed as being anemic because the baby is being attacked by the mother's blood because the baby has a different blood type from the mother. So we will take the donated blood that if you had a blood drive, this is your blood. We've taken your O-negative blood. We've placed it into a syringe. We use an ultrasound. We're going to guide the tip of the needle through the skin of the mother, through the wall of the uterus, and we're going to take that tip and we're going to guide it directly into the umbilical vein right there in the umbilical cord. And you're going to see that the baby is pumping unoxygenated blood through the umbilical arteries to the placenta, gets everything that the baby needs, and then pumps it back in the umbilical vein. And so we're going to take the tip of the needle, we place that with ultrasound guidance right into the vein, and then we give that baby the life-saving blood transfusion. You can see those red blood cells pouring in there. We have to sometimes do this every 3 or 4 weeks to give this baby a life-saving blood transfusion because the mom doesn't mean to attack her own baby, but the mom has antibodies which cross the placenta and attack the baby's blood. And babies can't even survive on the outside until they get to be about 24 weeks. So we're saving the lives of babies way before they can even be able to survive on the outside. So if we can give life-saving blood transfusions to a baby in the womb, does that baby meet the criteria of being a patient? Yes. And a patient is a person, no matter how small. We got a set of twins here, right? You're not just brothers, you're twins, right? All right. This is a story about the two of you, all right? Because a lot of times there's a condition called twin-twin transfusion syndrome. And I don't know exactly all the details of your gestation, but with twin-twin transfusion syndrome, you have a real big baby here, and its identical twin is really small. Well, why? They're identical twins because this one is selfish. This one is saying when nutrition is coming across the placenta, the big one's going, mine, 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 mine. And it's taking all the nutrition. Meanwhile, the little scrawny one here on the other side is saying, can I just have a little bit more? Just begging for some nutrition here. And so we're just going to call this one Esau. And why don't we call this one Jacob? But they don't come up with new movie ideas. You look at movies these days, they're just stealing stuff from history. So you might have seen it, they might have called it that back in the 80s. But what happens here? Esau is getting way too much and taking way too much of the nutrition. Poor Jacob is getting the leftovers. So how do we teach them how to share? We had a patient with twins just like this just last year. We sent them down to Texas Children's Hospital in Houston, Texas. And what do? They teach them how to share. How do they teach them how to share? It's like, I can't teach my kids on the outside how to share. They teach them how to share with a laser. They actually will go inside of the womb with a camera and with a laser, and we're going to show you how they do this. And what they're going to do is they're going to take the laser and they're going to cauterize. They're going to use the laser to divide the placenta in two, and they're going to say, Esau, this is your half of the placenta. Jacob, this is your half of the placenta. Now, you two play nice. It's tough because of the light coming in from the window, but these are the babies on the inside. You can see Esau over here. You can see skinny little Jacob over here. This is the camera coming in from the top of the uterus. You can see what's going on from the camera, but now we activate the laser. And the laser is activated. We cauterize this vessel, then we cauterize the next vessel. We go all the way from one side of the placenta to the other side of the placenta, saying, this is your side, this is your side. Now you two play nice, just like the aisle going right here down the middle of the sanctuary. We then get these patients sent back to us. They fly them back to us 10 days later. We follow them for the rest of the pregnancy. Where the big baby might have been at the 95th percentile when we sent the baby down, and the skinny one might have been at the first percentile, by the time we deliver them, they're 60-40. So if we can teach babies in the womb with a laser, just like Luke Skywalker with a lightsaber, if we can teach them how to share on the inside of the womb, because if the little one dies, the big one dies. If we can cure them on the inside, are they patients? Yes. And a patient is a person, no matter how small. Anybody remember this picture? All right, make you feel old. That was 25 years ago when that came out. This was a study that was being done at Vanderbilt University where babies who were diagnosed with spina bifida, a defect in their spine, were actually getting surgery on the inside, and then they stayed on the inside, and they wanted to see if the babies did better if they repaired it while they were on the inside than waiting till after they delivered. They stopped the study because it wasn't ethically correct, because they realized the babies that got the surgery on the inside hadn't had that option. When they followed them years later, the babies that got the surgery on the inside did much better than the babies that were forced to wait and got the surgery when they were delivered. So they said, this isn't right for us to randomize these kids. And they did. When they looked at 10 years later, the babies that got the surgery on the inside, they could go upstairs faster, downstairs faster. They had better control of their bladders, better control of their bowels. When they treated them as patients on the inside and then they followed them, we actually improved their quality of life for the rest of their lives, but just by treating them as a patient on the inside. But that was generation one, and that was called the mom's trial. And then we stopped making the big incisions in the uterus. We started doing it with a laparoscope. A gallbladder 30 years ago, you were in the hospital for probably 5 days, maybe a week, and you were, recovering. Now what happens? You go in, you get the Band-Aids on your belly. You're in the Chick-fil-A line before all the people for lunch. Technology is amazing. But that baby's hand right there is this 8-year-old who I met in Atlanta, is this kid who is now in college. Was he a patient there? Sure. Was he a patient there when I met him in Atlanta? Yes. Was he a patient when he was having spina bifida corrective surgery in the womb? Yes. And a patient is a person, no matter how small. But we don't make those big incisions anymore. We now go through with a laparoscope. And we were doing that for years. And then at UC Davis in California, Dr. Diana Farmer said, why don't we use stem cells? Some of you maybe have had stem cells injected into a joint, a knee, or a hip. And I don't have a problem with stem cells. It's all about what was the source of the stem cells. If the stem cells are coming from an aborted baby, that is not ethical. If a stem cell is being harvested from a placenta after a mom is already delivered, I have no problem with that because they were going to throw that placenta away. UC Davis originally tried to cure spina bifida by using stem cells from aborted babies. Well, what do you think God said about that? It didn't work. So then they thought, well, this isn't working. What's another option? They said, well, why don't we harvest mesenchymal cells from placentas after moms have already delivered? It worked. Well, how do you get stem cells to be applied to the defect on the baby's spine? Well, we have an animation for that too. They'll actually go into the room. They diagnose the baby with the defect. 2,000 babies are diagnosed with this condition. Most of them get aborted, sadly. And so what they'll do is mom has anesthesia. This is the defect in the baby's spine, where that's actually the spinal cord in yellow. So mom has an epidural, so she's comfortable. An incision is made in the mom's skin. A second incision is made in the fascia. A third incision is actually made in her womb or her uterus. And now you can actually have access to the spinal cord right there. So they will take a little hook. They're going to loosen up the skin around this defect. They're going to loosen up the dura, which is surrounding the defect on the baby's skin. Why? Because they want to apply some stem cells. So they're going to take the dura, they're going to separate it out, they're going to tuck the nerves of the cord back on the inside, they're going to close this layer called the arachnoid, and then they're going to take this patch which has stem cells. They harvested these stem cells, and what's a stem cell? A stem cell is a totipotential cell. This is like a 5-year-old. What's that 5-year-old going to be when they grow up? Anything that just need guidance and direction. A stem cell just needs guidance and direction. They can become any kind of cell. The stem cells are placed on the spinal cord. It's closed up. The womb is closed up. The skin is closed up. And then these stem cells say, now I know what I'm supposed to be. And these stem cells start to develop normal spinal cord tissue that is in the right condition. These babies which were not moving their legs in the womb start to move their legs in the womb, start to move their feet. They're having good control of their bladders. This is the future of how we're going to cure spina bifida, is by treating them in the womb. So if we can do stem cell therapy and cure a baby of spina bifida in the womb, did they meet the criteria of being a patient? Yeah. And a patient is a person, no matter how small. That's the first baby that had that surgery. That's Diana Farmer, who does the surgery, and that's the mom, Emily, and that's baby Robbie. And you're like, oh, it can't get cooler than that. They're doing spina bifida corrective surgery. You know, we're doing heart surgery on babies on the inside now. I'm going to take you over to Cleveland, Ohio. This baby was diagnosed with a condition called a teratoma. A teratoma means new growth. This is a tumor that was on the baby's heart. And where's this tumor? Well, in medical school, look for the big red magnifying glass, all right? Remember that for next year. You know, if you see the big red magnifying glass, this is an ultrasound of this baby in the womb at about 26 weeks gestation. This is the heart. This is the baby's chest. This is one lung. This is the other lung. This tumor is growing so quickly that they estimated this was going to kill that baby in 1 to 2 weeks. Well, the baby was a premature baby at just 26 weeks, so they told the parents, well, we can deliver a 26-weeker, but then we can do the open heart surgery, but now we have a 26-week baby in the NICU that just had open heart surgery. And they're like, well, that doesn't sound like a good option. They said, what else can you do? And they said, well, we think we have the technology and we have the team that we can operate on your baby in the womb, close everything back up, and let the baby finish growing on the inside. And that's exactly what they did. This is the actual OR team that operated on this little baby there on the inside. This is healthcare. Abortion is not healthcare. This is 30 doctors, nurses, and techs that went in the room. A mom had a heartbeat, a baby had a heartbeat. They did an amazing surgery, and then what was wheeled out? a mom with a heartbeat and a baby with a heartbeat. Abortion is you have a mom with a heartbeat and a baby with a heartbeat go into a room, a procedure is performed, and then only a mom with a heartbeat walks out of that room. If you are losing the heartbeats of half of your patients, that is not healthcare. Do not be lied to. But that is the actual team. They had anesthesiologist for the mom, and they had an anesthesiologist for the baby. If I'm doing a hysterectomy, does mom get an anesthesiologist? Yes. Does the uterus get its own anesthesiologist? No, because the uterus is part of the mom. If we have the mom comfortable, then we don't have to worry about the uterus. When we do surgery on babies in the womb, the mom has an anesthesiologist, but the baby is a different person. The baby gets its own anesthesiologist. But we're going to walk you through how they did this surgery. These are animations that are part of our new curriculum that we developed that's available now. So here's mom, here's baby. Baby's on the inside. Baby is perfectly normal, except baby has this tumor that is growing on the baby's heart. And you can see as we zoom in a little bit more, this whole white area, that's the tumor. That's the teratoma that's growing so quickly it's going to kill the baby. So mom has an epidural. Baby's on the inside. Mom is wide awake, but she's comfortable. Incision in mom, incision in the mom's uterus. Now we have access to the baby. We're going to bring out the right hand, bring out the left hand. The pediatric anesthesiologist actually starts an IV in the baby's hand. So the baby's getting fentanyl for pain. Norcuron is a paralytic. Cardiothoracic team opens the baby's chest. They remove the tumor. And then almost immediately, the baby's heart goes, thank you, and the baby's heart starts to pump normally. Once the baby's heart was pumping normally, they closed the baby's chest, took the IV out, tucked the hands in, closed the uterus, closed the skin. That was at 27 weeks gestation. How long did that baby heal on the inside? They let that baby heal for 10 weeks. That baby wasn't delivered until 37 weeks gestation. So if we can do open heart surgery on a baby in the womb, does it meet the criteria of being a patient? Absolutely. And patients have rights, and a patient is a person, no matter how small. That is that baby's hand, and that is the IV. You're like, it looks huge. Well, it looks huge because this baby only weighs about a pound, and so that's why the IV looks big. But you can see the perfectly developed little fingernail even on that baby, looking at in comparison to the surgeon's hands. But they were giving pain medicine to the baby and a paralytic to the baby called Norcuron, so the baby wasn't moving around while the baby was getting open heart surgery. That's Ryland after the surgery. Ryland had open heart surgery. Ryland is now 2 years of age, and he's doing well. He would have died on the inside if they hadn't treated him as a patient on the inside. And it's like, well, you're doing all that stuff, but it's not like you're doing brain surgery. Guess what, y'all? We're doing brain surgery for the babies on the inside now. There's a condition called a Galen malformation. Galen malformation, and a couple thousand babies are diagnosed with this each year. And the problem is there's a high-pressure artery that has an abnormal connection with a low-pressure vein. And it's kind of like trying to blow up your kid's water balloon, but using, a high-pressure, gas station, pump. Well, it's not going to do well. So with these babies, half of these babies get really sick after delivery, and of those babies that get sick, half of them die right after delivery. So the doctors up at Boston Children's Hospital said, we don't like losing a fourth of the babies that we diagnose with this condition right after delivery. Why don't we fix it while we're still on the inside? So that's what the doctors did. So this is the abnormal connection between the two, where this high-pressure artery is blowing up this vein, and that's the malformation. So this is how they did that. And we're going to show you, it's animation, but we're also going to say here a little interview with the surgeon. So mom is comfortable. They have anesthesia for the mom. They take a needle. The needle is guided with ultrasound. The needle goes through the skin of the mom, through the wall of the uterus, and where this defect is in the baby's brain, they guide that needle right into the baby's brain. The brain does not have pain fibers, so the baby does not feel any of that. Here's the abnormal connection between the high-pressure artery and the low-pressure vein. And this vein is just bulging, ready to blow. So the needle comes in, then they start taking vascular coils, and they start piling in these coils. 1 coil, that wasn't enough. 2 coils, 3 coils. Trump would say they're building a wall. So they're building a wall between the connection with the high-pressure artery and the low-pressure vein. They build that wall, and they stopped the abnormal blood flow. They then removed the catheter, and they delivered the baby later, and the baby is baby Denver. So if we can do open heart surgery, spina bifida corrective surgery, laser vascular surgery, and brain surgery, are these patients in the womb? Yes. And a patient is a person, no matter how small, and that's baby Denver. Sanjay Gupta, CNN, that's the, what's CNN stand for? Conservative News Network? Yeah. So I like Sanjay Gupta. I didn't realize it. He's a gifted neurosurgeon. He's a really smart guy. But Sanjay Gupta heard about this. But I want you to listen to the audio of Sanjay Gupta when he was reporting on this amazing brain surgery for a baby in the womb.
In utero surgery also means they had to take 2 patients to the operating room instead.
What did he just say was in going to the operating room? Yeah, listen to that.
In utero surgery also means they had to take 2 patients to the operating room instead of 1. And they had to then very carefully thread a catheter right into the middle of the...
Who would have thought Sanjay Gupta and CNN would agree with us? But they're saying 2 patients, and clearly this is 2 different patients. So if it is, what's the definition of a patient? A patient is a person receiving health care. Have I just shown you how we are providing health care to these patients on the inside? Yes. And if they are a person under the 14th Amendment, nor shall any state deny any person of life, liberty, or property. It's an excellent defense for the preborn because they are patients, therefore they are persons, and if they are a person, then under our Constitution and our Declaration of Independence, they have rights. But despite the amazing advances in healthcare, and we're doing all these amazing things on babies, we still had 111,000 people die of drug overdoses just last year. In Florida, it was almost 8,000 people died of drug overdoses. Most of them were with narcotics. The number 1 narcotic was fentanyl. But does everybody who makes a bad decision and takes a narcotic and overdoses, do they all die? No. We've got an antidote, and the antidote is called Narcan. Narcan reverses. It's like Sleeping Beauty. Sleeping Beauty might have just overdosed on fentanyl, and then Prince Charming had some Narcan on his lips or something. But you can actually get Narcan on Amazon. It's in congregations. It's in schools. It's in rehabs where if somebody makes a bad decision, they overdose on a narcotic, we can give them the antidote, and they wake right up. Well, we have another problem besides narcotics in the country, and that is the abortion pill. The abortion pill is 98% effective in killing a baby, not the morning after, like the morning after pill, but up to 10 weeks gestation, it will kill that baby on the inside. That's the size of a 10-week baby on the inside. This baby has fingers, fingerprints, feet, moving around the inside, a beating heart, a brain up there, and they're about an inch in length that are about that big. And it is 98% effective in killing that, and a lot of times it's delivered mail order. Now, does everybody happy about the fact they took the abortion pill? No, lots of women have regrets, and they aren't happy with the decision they made. 3 months ago, the number of abortions in the United States that were performed with the abortion pill was 54%. We just got new data that shows that the number of abortions is now 63%. The numbers of abortions have gone back up over 1 million again. So if 63% of the abortions are performed with the abortion pill, and we have over 1 million abortions here in the United States each year, that means that we have over 630,000 babies with heartbeats and fingers and toes that are dying because of the abortion pill. The population of Miami is only about 450,000. So we have more babies being killed by the abortion pill each year than every man, woman, and child in the city of Miami. When it comes to risks, are there risks to the baby? Yeah, 98% of the time, that baby's going to die. What about risks to the moms? Yes. The number 1 pregnancy-related cause of death of women in the first trimester of pregnancy is a ruptured ectopic or tubal pregnancy. So when somebody is getting the abortion pill mail order because they have a positive pregnancy test, 1, you don't know how far along they really are, and 2, you don't really know where that pregnancy is. 1% of all these women who get the abortion pill, that pregnancy statistically will be in the tube, and that is going to be a risk to her life. But moms have regrets for this. We don't have time to go through the science. That's a website you can go through to get some more of the science. I've attempted 19 reversals myself. I've been successful 15 out of those 19 times. But that's the perfect example of what it means to be redeemed, where you had a mom who made a bad decision, and that baby is on a path. 98% of the time, that baby is going to die. Well, what do? We invest $100 worth of something called progesterone, which is the antidote. It's like the Narcan when somebody overdoses on narcotics. We invest with progesterone, and we are buying back the life of that baby. About 70% of the time, we are able to buy back the life of that baby. That's every one of you, too. Every one of us was on a 100% path that we were going to be separated from God for all eternity. Yet what did Yeshua do for us? He invested something much more precious than progesterone. He invested the blood of Yeshua as the redemption to buy us back. That's what it means to be redeemed, to buy back. So we buy back the lives of these babies with progesterone, yet we are bought back with the blood of Yeshua. This is the first reversal I was involved in. It cost me $109. Is that worth it to save the life of a baby? Absolutely. And what happened? The grandma sent me a picture because guess who started kindergarten in her little pink and purple dress? So we're not just saving the life of a beating heart of that baby in the womb. We're saving the life of a person that's going to live for decades, and we're saving a whole nother generation, which is going to come from this child. This is one of my more recent reversals, me with mom and baby. And this is a beautiful couple. Mom was pregnant. She was dating the guy for a long time. She became pregnant, panicked, didn't even tell him she took the abortion pill. And then she was driving home and she had immediate regrets. She had immediate regrets, contacted us, and we were able to help her reverse it. She told the boyfriend, hey, lots happened. I was pregnant, took the abortion pill, took the antidote. I'm having a baby. What do you think? He was thrilled. Guess what happened? They named the baby William. What's my name? William. What does William mean? William means the bold protector, so I think it fits. But that's baby William. But guess who came to visit me about 2 months ago? Baby William. Why did baby William come to visit me? Because mom's pregnant with another baby. She's having a little girl this time. So it's an amazing ministry to save the lives of these babies. When it comes to life, who created life? Genesis 1:26 says, and God said, let us make man in our image after our likeness. Is that on our birthday? No. Because I can determine what your birthday is. I can induce you or I can do a C-section. I don't have the power to determine when you're created in the image of God. We're created in the image of God at the moment of conception. There, the American flag. Why do we put the American flag up there? Because you ever seen somebody burn the American flag? Ever seen somebody burn the flag of Israel? Well, why do they do that? Because if you hate Israel or you hate the United States, you want to burn the image which represents Israel and represents the United States. That's why this is a spiritual battle. Somebody has a hatred for God. We're created in the image of God at the moment of conception. Abortion is an attack on that image of God that is there within the womb. Right there at the moment of conception, there's a flash of light, which is amazing. We can go over that in more detail sometime later. Jeremiah 1:5. Jeremiah was having a bad day. And God said to Jeremiah, he says, Jeremiah, before I formed thee in the belly, I knew you. Before you came forth out of the womb, I sanctified you, and I ordained you to be a prophet unto the nations. God had a job for Jeremiah to do. God has a job for every one of you that is there for you to serve his kingdom, and he has a relationship with us in the womb. Psalm 139, the psalmist didn't understand about cell differentiation and how cells divide and become a baby. He knew there was a night of romance, and then 9 months later, a baby came out. So how did he describe it? He said, God, you formed my inmost being. You knit me in my mother's womb. I praise you so wonderfully you made me. Again, this is a spiritual battle. This is not just a choice. This is not vanilla or chocolate, coffee or tea. Spiritual battle. 18 to 24% of the people in any congregation statistically have personally been involved in an abortion. They are hurting. They need healing. Healing comes from true forgiveness. True forgiveness only comes from Yeshua. Romans 5:8. Anybody here a sinner besides me? We had a couple. All right. But God showed his love for us in this: while we were sinners, Christ died for us. Well, what does it say in Psalm 51:5? When were we sinners? Surely I was sinful from the moment of birth. I was sinful from the time my mother conceived me. So that's, if we were sinners from the moment of conception, and God had that much love that he sent Yeshua to live a perfect life, give his life, and then conquer death, that's the love that God has for the babies in the womb. You have a bold rabbi. You don't need to worry about him being declaring bold. But even Paul, when he wrote to the church of Ephesus, he said, pray for me that I might have the courage to speak as I must. You have a bold rabbi to have somebody like me. How many rabbis have an obstetrician come to speak and teach on Shabbat? Not many, but you have a bold one. We have done well, the will of the people. We have brought the gestational age cap here in Florida through legislative efforts from 24 weeks to 15 weeks to 6 weeks, and we were getting ready to go after the abortion pill. But we have also have too many churches who say, we don't get involved in politics. We've had this response. We're having a pastor, priest, rabbi meeting on August 29th. We have actually had pastors from large congregations here in Pensacola say, we don't get involved in politics. Well, the same thing happened in Germany with the Christian and with the Catholic Church and the Protestant Church in 1941 when they didn't get involved in politics, and over 6 million Jews were sent to the concentration camps and the gas chambers. We have a duty and we have a right to get involved in politics here in the United States, and we have had victories. But we were celebrating because we had a victory with the 6-week heartbeat bill, which passed on May 1st. But ACLU of Florida, Planned Parenthood in Florida, then got involved because the wicked cannot sleep until they have done what is evil. That has been true for all eternity. Just because we have a victory, we can't say, hey, we won, we're protecting babies, and we're going after the abortion pill. They did not sleep, and now we have amendment number 4. They've already injected $20 million, and they just injected a second $20 million on amendment number 4. We need to vote no on a 4. This is the breakdown of 4. It says no law. So if this amendment becomes law, it can't be reversed by a governor executive order or a law through the House or the Senate before viability. You can't prevent abortion before viability, probably around 24 weeks. We're doing that heart surgery at 27 weeks. We're doing blood transfusions at 18 weeks. Or, and here's the big kicker, when necessary to protect the patient's health. Well, what's health mean? Health was actually defined in a case called Doe versus Bolton, which was released the same day as Roe versus Wade in 1973. They defined health as physical, emotional, psychological, familial, and age. So mom's too young, mom's too old, grandfather doesn't want her to have the baby. Mom has depression, mom has anxiety. This is what the definition of health would be if this amendment becomes law, as determined by her health care provider. So it's not even an independent council or group of physicians. What's a health care provider in Florida? Doctors? Yep. Nurses, yes, nurse practitioners, physicians, assistants. It goes all the way. Do you know that tattoo artists are governed and guided by the Florida Department of Health? Do we really want tattoo artists determining if you can have a late-term abortion? So the real key is if amendment number 4 passes, there's no law that could reverse it. Abortion at any gestational age for any reason would be protected here in the state of Florida. And we would be a place for abortions from the other more pro-life states. And we would be paying for those abortions. So that's the level of evil that we are experiencing here on amendment number 4. Can we win? Yes. We serve the Almighty God. What's our most important tool? It's the gospel. It's the good news. It is the gospel that changes hearts. It's the gospel that changes minds. It's the gospel that changes behavior. Yes, it's important to go through the science that we went through. It's important to go through the medicine that we went through. But the real answer for this spiritual battle is the gospel. And when we use the gospel, we will save the lives of God's preborn. We will bring healing and redemption to millions of moms and dads. And we will not only save the state of Florida, but we will save the United States as well. So that is the answer for this dilemma. But God bless you all. We'll take a few minutes for questions. Rabbi.
For those that want it, we have a long-form version of information about the amendment that you can get. We also have a Cliff Notes version for those that don't want to take the time to read the long version. So we have those available. They'll be on the table over here. We encourage you to get those. We also have
abortion pill reversal. Oh.
A mess that I created on the floor. So, cards with information about stuff. So, all this is available on the table. And I encourage all of you to sign up to be on his yesterday. Go ahead.
I don't know if people are aware of it, but the abortion facility that used to be over behind Home Depot was shut down a couple of years ago because they almost killed 3 women. But there's now a facility that's open in Pensacola that is affiliated with a abortion clinic in North Carolina. They actually refer women. They're called a referral center. And so women that come into there, they get help getting transportation to North Carolina to have abortions. The bad thing about this is will become a city if this amendment passes. It is very likely that that particular unit that I just talked about will become an abortion facility doing abortions. And the building that was shut down very likely will come back up.
Yeah.
So we're talking not only the right to identical when we can celebrate success and wins. The reality is we're going to become a city right outside the borders of Alabama.
Yep.
Yeah, and it becomes, if this passes, and God willing it won't, and if we do our job and we share with people, because the truth is, even the liberal people in our state aren't for late-term abortions. If we can just get them to say, I know you don't agree with me on everything, but we all agree there shouldn't be a law that allows this. We can get them to vote against this amendment because they're not for it either, but we have to be active in doing so. ProLifeDoc.org. You can get information on his class, the curriculum that he now has out. You can make donations for those. Okay. You can make donations if you want to donate towards this abortion pill reversal. That's there. You can do that through his website. Also, it's important to know that when the news media is reporting that abortions are down, now it's not that they're down, they're just more people are using the abortion pill than going to an abortion clinic. The numbers are actually higher of those who are having abortion. So that's really important to note. Before we break for service, last night I posted that one of my grandson's teammates on his football team was in a very bad car accident. He was released from the hospital this morning, but his little brother is right now showing little to no brain activity, and we want to pray for him right now. I just got a text. His name is Knox. So, Abba, Father, we just joined together as family, as people who love your creation. Father, this child is yours. And so we pray for Knox right now, and we ask that you would work a miracle in this little boy's life, that you would strengthen him, heal him, restore him, as only you can, as a testimony of your faithfulness and love. And we ask this in Yeshua's name. Amen and amen. We're going to take a few-minute break. If you want to talk to Dr. Lile, he's here. And that way everybody can reform in 7 minutes for service.